So here I am doing my usual digital dentistry. I have had a patient in, sat in my chair about 9 o'clock. It is now about 9:40. We have a restoration that has been designed and is now in the furnace over here. And this is how my life is. I will sort out a tooth in an hour, hour and a half, putting a nice Emax onlay on this patient. And I was thinking about where my life has come from, and I qualified in '88, and at that time everything was analog, so all my notes were handwritten, wet x-rays, 35mm camera, and now everything, well not everything, but most things are digital. So I now have computerized notes, digital x-rays, CEREC machine to allow me to make restorations in an hour, or a smile makeover in a day, 6-7 hours usually, from 8 finish about 2. If I'm using guided surgery, I will be using the computer to do a scan and morph that onto a CT scan. If I'm diagnosing, obviously I'm using my digital x-rays and my photography. If I am treatment planning, I'm using a DSD 3D thing, which allows me to morph photographs to scans of arches, of models maybe, and really I have digital running through my whole of my workflow. Why should I bother doing this? The reason why I bother doing this is because it makes my life interesting and enjoyable. It makes things easy for my patients. Restorations are in my control and fit beautifully. And yes, there is an increase in profit from my practice. So it ticks so many boxes, but the main thing is the enjoyment of it. I have a patient outside now. This is going down, the oven is dropped down now, and about 10 minutes, 15 minutes time, I better fit it, so I better say bye and cheers.